Vaginal bleeding is a normal part of a woman's reproductive cycle, but when it occurs outside of a regular menstrual period or at unexpected times, it can be a cause for concern. Understanding the potential causes of vaginal bleeding, how it is diagnosed, and what it signifies is essential for women to make informed decisions about their health. This video will cover the key causes of vaginal bleeding, the diagnostic process, and answer frequently asked questions related to this condition. Stay tuned and don't forget to subscribe to our channel for more informative videos on women's health. Click the notification bell to stay updated. Normal vaginal bleeding occurs during a woman's menstrual cycle, typically lasting 3 to 7 days. A cycle lasts between 21 to 35 days. Normal bleeding occurs in response to hormonal changes, marking the shedding of the uterine lining. Abnormal vaginal bleeding includes bleeding between periods, bleeding after menopause, excessively heavy menstrual periods, bleeding after sexual intercourse, bleeding during pregnancy, and bleeding associated with pelvic pain or discomfort. Hormonal imbalance can lead to irregular menstruation, such as anovulation, where a lack of ovulation causes the uterine lining to shed irregularly. Polycystic ovary syndrome, or PCOS, is a hormonal disorder causing irregular or absent periods, often leading to abnormal bleeding. Pregnancy-related causes include implantation bleeding, which occurs early in pregnancy when the embryo attaches to the uterine lining, miscarriage, where vaginal bleeding can be one of the first signs, and ectopic pregnancy, where a fertilized egg implants outside the uterus, requiring urgent medical attention. Uterine and cervical conditions such as fibroids, which are non-cancerous growths in the uterus that can cause heavy menstrual bleeding or bleeding between periods. Polyps, small growths on the cervix or uterine lining that can cause irregular bleeding, endometriosis, where the uterine lining grows outside the uterus leading to pain and abnormal bleeding, endometrial hyperplasia, a thickening of the uterine lining causing heavy or prolonged bleeding, and cervical cancer, where abnormal bleeding, especially after intercourse, may be a sign. Infections and inflammation, like pelvic inflammatory disease, an infection of the reproductive organs that can cause abnormal bleeding, sexually transmitted infections such as chlamydia or gonorrhea, and vaginitis, inflammation or infection of the vagina resulting in light bleeding. Medications and medical procedures, including hormonal contraceptives, blood thinners, and post-surgical bleeding after gynecological surgeries like hysteroscopy or biopsy. Menopause and postmenopausal bleeding, where perimenopause, the transition phase before menopause, can lead to irregular periods and unpredictable bleeding, and postmenopausal bleeding, which is not normal and should be evaluated for serious conditions like endometrial cancer. Trauma or injury, such as vaginal trauma from intercourse, medical procedures, or physical trauma, can also lead to bleeding. A detailed medical history, including menstrual cycle patterns, medication use, sexual activity, and associated symptoms, is essential. A pelvic exam to assess the vagina, cervix, and uterus. Diagnostic tests include blood tests to check for anemia, hormone levels, and thyroid function. A pregnancy test to rule out pregnancy-related causes like miscarriage or ectopic pregnancy. A PP smear to screen for cervical cancer or abnormal cervical cells. A pelvic ultrasound to visualize the uterus, ovaries, and fallopian tubes, helping diagnose fibroids, polyps, or ectopic pregnancy. An endometrial biopsy to check for cancer or hyperplasia, and hysteroscopy to examine the inside of the uterus using a small camera. Imaging and advanced testing, such as MRI or CT scans, are used in cases where detailed images are required to assess masses or abnormal growths, and colposcopy, an in-depth examination of the cervix if abnormalities are detected during a pap smear. Section 4. What vaginal bleeding may mean. Menstrual irregularities. Variations in bleeding are often related to hormonal imbalances or life stages like perimenopause. Pregnancy complications. Bleeding can indicate implantation, miscarriage, or ectopic pregnancy and needs medical evaluation. Underlying gynecological conditions. Conditions like fibroids, polyps, and infections can lead to abnormal bleeding, which often requires treatment. Serious health concerns. Postmenopausal bleeding and heavy bleeding could signify serious conditions like cancer and should be addressed immediately. Section 5. Treatment of vaginal bleeding. Medication, hormonal therapy, birth control pills, patches, or hormone therapy can regulate menstrual cycles. Non-steroidal anti-inflammatory drugs, or NSAIDs, can reduce heavy menstrual bleeding. Antibiotics. If the bleeding is due to infection, antibiotics may be prescribed. Surgical options, dilation and curettage, or D&C. A procedure to remove part of the uterine lining. Myomectomy, surgery to remove fibroids. Hysterectomy, removal of the uterus in severe cases such as cancer or unmanageable fibroids. Endometrial ablation, a minimally invasive procedure to remove or destroy the uterine lining to treat heavy bleeding. Lifestyle and home care. Managing stress and maintaining a healthy weight can help regulate periods. Keeping track of menstrual cycles can help detect patterns or abnormalities. Section 6. Frequently asked questions, or FAQs. Q. Is it normal to have spotting between periods? A. Occasional light spotting may be normal, especially with hormonal contraceptive use or around ovulation. However, persistent spotting should be evaluated. Q. What causes heavy menstrual bleeding? A. Heavy menstrual bleeding can be due to hormonal imbalances, fibroids, polyps, or other uterine abnormalities. Blood disorders and medications like blood thinners can also contribute. Q. When should I see a doctor for vaginal bleeding? A. Seek medical attention if you experience bleeding after menopause, very heavy periods, bleeding between periods, or bleeding during pregnancy. Additionally, see a doctor if bleeding is associated with severe pain, dizziness, or fatigue. Q. Can stress cause abnormal bleeding? A. Yes. High stress can affect hormone levels, leading to changes in the menstrual cycle and causing irregular bleeding. Q. How is postmenopausal bleeding treated? A. Postmenopausal bleeding is not normal and usually warrants an evaluation to rule out serious conditions like endometrial cancer. Treatment depends on the underlying cause. Q. Can birth control pills cause breakthrough bleeding? A. Yes, breakthrough bleeding is common when starting or changing birth control methods. It usually resolves within a few months, but if it persists, consult your healthcare provider. Q. What tests are done to diagnose abnormal bleeding? A. Common tests include a pelvic exam, pap smear, pelvic ultrasound, blood tests, endometrial biopsy, and in some cases hysteroscopy or MRI. Q. Can fibroids cause bleeding? A. Yes, uterine fibroids can cause heavy or irregular bleeding, especially during menstruation. Q. How can I stop abnormal vaginal bleeding? A. Treatment varies by cause. Hormonal medications, antibiotics for infections, or surgical options may be recommended by your doctor. Q. Can abnormal bleeding be a sign of cancer? A. Yes, especially in postmenopausal women. Abnormal bleeding can sometimes indicate cervical, uterine, or ovarian cancer and should be evaluated promptly. Conclusion. Vaginal bleeding can have many causes, ranging from normal variations in the menstrual cycle to more serious underlying conditions. It is important to monitor your symptoms and consult a healthcare provider if you experience any abnormal bleeding. Early diagnosis and treatment can prevent complications and improve overall health outcomes. If you have any concerns, don't hesitate to reach out to your healthcare provider or schedule an appointment today.